So, hello and welcome again, my
Thank you.
friend Nazariy. Do you remember when we did our last interview?
Oh, yes, I do. It's already some time ago, right?
It was in September 2021. And I think there have been so many changes in your life, in our life, in the global life, that I was thinking we need to catch up. A lot of positive things, a few negative things that happened. I want to congratulate you for being a daddy, for a wonderful wife, having a family, because I can tell you having a family, and now you know it, being a father, having a family is one of the best things for me personally in the world. Do you agree with that?
100%. It's something that is completely different, not comparable to anything. And I'm a big fan of dentistry, but I truly believe that the time that I spend with my family, and especially with my child, is the most precious time nowadays in my life for sure.
And then the next step, you can ask your father, becoming a grandfather or grandmother. That's the next step.
Yeah. In my case, I need to wait a little bit before that. So
Yeah, yeah.
my son is only 7 months old,
Yeah, yeah,
but
but it's
hopefully,
growing and time is really flying. Okay, let's
yeah, I
let's
agree.
get back to dentistry because I realize I'm following you, and you are really, for me, you are one of the dental globe trotters. I see that you are lecturing almost every week in some places. Maybe let's start with the story of moving outside of Ukraine, because I know that you had an education center there,
Mhm.
and I heard some stories, but I want to I want to hear it from you. How did you then move out? And I know that you have sorry, sorry, my voice, that you have one education center in the US, in Las Vegas, and another one in Malaysia, in Kuala Lumpur. And
That's
maybe
correct.
tell us a little bit about the story moving out from Ukraine and building this global network, because this is really amazing at your age, building such a huge network.
Thank you. Before the war started, before Russia invaded Ukraine, my training center was in our family hotel that is in the mountains. So we basically organized, I would say, a really unique experience for dentists from around the world who would come to the mountains. We would spend 4 days together. We would have a live patient course where we showed all the details with a real patient from A to Z doing a smile makeover in 4 days. And also people had a chance to enjoy the mountains, to go skiing or just to walk around. But when the war started, of course, that was a big problem for people from abroad to come to courses. And I clearly understood that people will not go because they are just afraid for their safety. And this is why I took decision to move the training center to Las Vegas, US, because I have my good friend and he said, listen, Nazariy, if you want, I have a space here and we can collaborate together and put the training center here. And it took me only 5 seconds to make the decision. So I collected all my technology, all the stuff from the training center in Ukraine, and just flew it with a plane to Las Vegas and set up the training center in Las Vegas. So that was the step number one. That's a really interesting experience. And the step number two, I also got a call from my partners in Kuala Lumpur. They said that they saw my training center in Las Vegas. They really liked the way how we do courses, because one of my dreams when I was creating a training center was actually to create maximum clinical conditions. So I can say that in my training centers, you can find all possible technology that exists nowadays when we speak about prosthetics and especially the digital workflow. So printers, milling machines, scanners, facial scanners, microscopes, phantoms. So quite often we have colleagues coming to the courses and they say, we don't have all this technology, even in our office that you have here in the training center. But again, that was the goal. And thank God we were capable of putting things together. And then when I got the offer from Kuala Lumpur, I was also open to it. Plus, one of the most important things that people who contact me and people that I cooperate with are usually amazing human beings because for me, it's number one priority. not just the business side, not just the financial side, because nothing is going to work if your partner is not a nice person. So I'm very lucky to have my partners as really amazing people, and I'm very proud to cooperate with them. And now we actually focus our courses in these two locations, US and also in Kuala Lumpur, Asia.
So you're just covering the whole world. So you started from Europe, went to the US, went to Asia. So this is like also a smart move to be a little bit a global player in education. And I really like the concept of being like a dental school, a small dental school, but specialized in modern, don't call it the term digital dentistry. I always tell people, look, digital is fingers and numbers, and
Mhm.
we all are digital dentists in some extent. Not everybody can afford all the technologies, but I think showing what man and machine can do is
Mhm.
really smart. And I remember the lecture we had in 1985, Professor Merman. I was a student, and Professor Merman presented us the CEREC system. And he was
Mhm.
saying, dear colleagues, imagine this machine, your patient and yourself doing dentistry together. So that's the philosophy of chairside dentistry. And I have asked you several times, what are your thoughts about chairside dentistry and mixed dentistry? Because your father is a famous lab technician. So you are maybe the one say, well, I prefer to have more lab work integrated into my workflows because I want the best possible. But what is your opinion on chairside dentistry, which for sure is also more affordable for the patient at the end? Or let's say this is because this is something that a lot of people are asking me, Nazariy, with all these gadgets, with all this technology, we cannot even afford buying the technology. So let's talk about the patient with all this technology. Can the patient afford that? So I remembered also a discussion with Michael Appa, and now he's saying,
Mhm.
well, everybody deserves a Michael Appa smile. Now he opened like a center at the university where they
Mhm.
offer like a little bit more affordable Appa smiles. So what is your concept of treating as many patients as possible? Or is your intention always to be like the top-notch niche dentist for the elite that can afford that? So this is a question that a lot of people are asking me, referring to you.
Mhm. I would divide my answer in two parts. The part number one is, first of all, to realize why people are not capable of getting that technology. That's the problem, because people do not build the strategy. I'm speaking right now about the dentists. The dentists, they see their lives that they only go to the dental chair and they only work with the patient inside of the mouth, sorry. And they do not devote enough time to build the strategy, how to grow. Alessandro, in 2010, I was charging per unit 70 euros, 70, 70 euros. And I could probably also choose two different directions. I could choose how come I can decrease my expenses so I could make money out of 70 euros, or I could choose the way how to add another zero to the price. So that's the point. So I think that the truth should be somewhere in between. What I'm trying to say, again, in my opinion, dentists should always build a strategy how to grow their office, how to grow their business. Because if they don't do this, they work today as a dentist, and then 20, 30 years later, they will be doing completely same thing without any type of progress. I completely also agree that somebody is more capable in this, somebody is less capable in this. But then, nowadays you can always get help from the side. That's the point. And that's the first part of my answer. So not just to focus on seeing the tooth. Definitely, this is number one priority. But additionally, in the modern world, you need to understand again how to develop your office, your dental office. Then another part of my answer is about the charity work. A lot depends on what type of work you're doing. That's the point. Because if I again look back in 2010, 2012, people in Ukraine sometimes were joking. They were calling me one tooth prosthodontist because I had a lot of cases with a single central. And that was, by the way, our start with my father when we started to demonstrate our cases, all single centrals. It's not easy to make a single central. So usually most of the cases I was doing were small cases. So when we speak about small cases, this is something the dentist can maybe do chair side. 2 3 units, maybe somebody can do 4 units. Starting from 2015, I completely changed my strategy because I decided that I want in my offices to make only big smile makeovers, to focus only on either 10 units veneers or full mouth reconstructions. So nowadays, if you look at the statistics of my offices, we're conducting 80% of full mouth reconstructions and the 20% are smile makeovers. Usually it's a combination of orthodontic treatments and ceramic veneers, minimally invasive. And if it's a full mouth reconstruction, it's both on teeth and implants. And usually, again, I cooperate with many specialists. So I do not do cases just prosthetically driven. I have all specialists, periodontists, endodontists, restorative dentists, orthodontists. So they all prepare a case for me. So as a prosthodontist, I can finalize a case in a good way. So when we speak about the full mouth reconstruction and 28 units, then I have a question for you. Would you do it chairside?
Yes.
Yes, probably then.
Yes, because I'm doing it for over 30 years. I'm listening to your strategy, and I have a question because I felt I started with this machine and I was like from the very first beginning when
Mhm,
the software were able to do veneers, then the software was able to do crowns. And then
mhm,
I started experimenting. My cases don't look as nice and as good as yours, but my borders are clean. And I think that I'm doing a decent dentistry. I don't want, and it's not about comparing each other. It's about how
mhm,
you treat your patient. At the end, my patients need to be happy what I'm doing with them. If they look into the mirror, I have to say, I like it. It's nice. It lasts. So these are the key questions. And then you need the confidence and the training to do this, to visualize things. So basically, when I have my patient in front of me, I already see, without doing smile design, I already see how the teeth
mhm,
might look afterwards. If I prep a tooth, I feel a little bit like it's like if you ask an artist, how do you make a horse out of a stone of marble? You know how it works?
mhm,
Cut away everything that doesn't look like a horse.
mhm. Yeah, true.
But we both could not, maybe you, I don't know, but I could never do a sculpture of a horse, you know?
Mhm,
This is an amazing capabilities, training, practice to reach that. And I know that a lot of people are afraid to even prep 4 teeth in the front, knowing that
mhm,
they need to deliver the final restoration the same day. So a lot of
mhm,
people are moving and say, I prefer to do the impression, do a temporary. The temporary maybe not even looking good, but I know my lab technician will help me to get a decent result. So these are different strategies. But
yeah, yeah.
yeah, but my question then is how did you manage to do the switch? It's easy to say, like if I would start playing golf, I could say, oh, tomorrow I will be PGA pro. Okay, but how can I say tomorrow I want to be a full mouth rehab dentist? How do you, what are tips, let's say also for the younger generation, because this is something that you see, especially now on social media. A lot of young dentists,
Mhm,
they would love to be like you. They would love to be like Dr. Appa. They would love to be like, you name it, a lot of colleagues, but not knowing that you, Appa, and you name them all, are hard workers. You work hard for what you're doing. So what would be an advice for a young dentist saying, yes, I like the idea, the philosophy of Nazariy of switching from single tooth dentist to, let's say, full mouth or more restoration dentists. What would be the advice for the young generation?
Before I answer your question, I would like to comment a few words about the previous question. The thing is that, for example, in my office, I'm managing multiple doctors. So I have a team that's working for me. So for some people, for example, like you, it's interesting. It makes sense to do all the stuff yourself. And that's also amazing. That's also the way of doing things if they work comfortably for me. So for me, business wise, is more interesting to do the prosto parts, prepare teeth, send the case to the lab, and then I can focus on the other stuff, either organizing in the clinic the work or, I don't know, prepping another patient. But business wise, financially, for me, it's more interesting to work as a prosthodontist and leave the lab parts for the lab. Okay. But again, everybody has his formula and you can be successful both ways. I'm just sharing our experience. Okay. Then speaking about the full mouth reconstructions, I was dreaming starting from 2010 when I was doing those single units that one day I will do cases like Dr. Mauro Fradani, for example. By the way, I was super happy and lucky and to visit his courses back in 2012. And he was, I would say, one of the people who inspired me. And this was my goal, actually, to work with the people who need this type of work. Because what we have to clearly understand, um, it doesn't mean that all the people who come to your office need full mouth reconstruction. That's something that I would like to clarify from these moments. It means that you have to focus specifically on the audience who need this type of work. It's the same that there are offices who are working only with the edentulous patients. And this is their specialization, and they only do this type of work. Somebody enjoys doing mixed dentistry. That's also the way. Okay. But for me, I felt like I could really change the smiles and improve people's smiles, and not just aesthetically, but of course the function, only in cases when I'm doing it globally with the mouth. So cooperating with the orthodontists and also with the other specialists. So this is how my first step actually was like this. When I started to receive the patients in my new clinic in Kiev that I opened in 18, I would be like this. I check, I analyze the patient, and I would say, okay, you have a wear of your teeth. You need a full mouth reconstruction. But the patient says, no, I just want these anterior two teeth because on the picture, they don't look beautiful. And I was just saying, I'm sorry, but we are not working like that. So we either do it the right way or we don't do it at all. So this how it was at the beginning. I was just refusing many patients and some little percentage was staying. So the thing is, you need to stop being afraid of losing people at the beginning, because this is what's going to happen. Because this is when you are changing your auditory from one auditory that was doing small cases to completely different auditory that's doing complete cases. And then when you are started doing your first cases like full mouth rehabs in the office and you're doing good, your patients see it and your patients have their friends, they have their relatives. And then this is how the snowball becomes growing, and they are starting referring those people. And then your clinic and you as a specialist are becoming known as the person who is doing big, difficult, functional, aesthetic cases. So nowadays, I would say 95% of people who come for the consulting in my offices are people who completely understand that they need either full arch or full mouth reconstruction. So those are, I would say, the basic advices for the beginning. And this is how I started at the beginning. Of course, I don't want this to sound as a promotion, but this is something that we actually teach from A to Z on our training courses, both in
Yeah, basically,
Vegas and
the
yeah,
education, the good education, and for a dentist, we need to work on our manual skills. All this
yeah,
online education and everything, that's fine. That can help to transfer the basic knowledge, but learning the skills, become better in dentistry only works by practicing with your hands. So that's for me, that's obvious. It's like you cannot become a Formula One driver just by driving in the simulator. Although I know that the best Formula One drivers are only becoming better if they are good also in the simulator. So this is something different. But simulators in dentistry, that's an interesting thing. are not there yet. I think that's maybe something interesting. I don't know if you have looked at this virtual reality or virtual reality training things. For me, all of them look like a little bit. I felt like an astronaut with the big gloves of an astronaut, and then trying to do a preparation of a tooth with these gloves. And the first thing everybody would do is trying to get rid of these gloves to have the fine
Mhm.
feeling
The
with the
feeling.
fingers. I know that there are some universities having these dental training machines that where you can learn a little bit to work with the handpiece, but this is limited. I think it's limited to very small amounts of
Mhm.
our education and never replacing courses like you are doing or others are doing. So, but what are your thoughts? Have you tried these tools?
Yeah, I tried, and in this point, I completely agree with you. I mean, looks like a pretty cool gadget, but when we speak about the real training, this is something that we were trying to organize in our training centers, that you sit down straight with a microscope. Here you have a phantom just like a patient, positioned completely the same. On the left, you have your assistant. On the right, you have all of your hand pieces with water. You have suction close to assistant. You have a rubber dam. You have intraoral scanner. So you have real clinical conditions, not holding the model like this. I see quite often events when people hold the model and they tap like this on the model. That'd be nice if you could detach the teeth and jaw from the patient and do the treatment like this, but you cannot. In my opinion, yeah, it gives you some value, but it's completely different the way you work with a patient. Because when you have a phantom that is positioned exactly like your patients in the office, you have to use your brain to understand how to position the mirror properly, how to position the handpiece so the water doesn't go on the mirror. And once you figure out how to do this on this phantom head, then you go back to your patient and you realize that's completely the same. Because the head is not plastic, the head is real. But the ergonomics, the way how you cooperate with your assistant, how you work with the handpiece, the mirror, the rubber dam is completely the same. So, in my opinion, the most proper way nowadays, at least, to learn how to work clinically in the mouth of the patient.
I totally agree. So basically, it's a little bit, let's say, old school. We had that many years ago already at dental school, but sometimes the traditional methods are not the worst. And basically, a lot of basic skills how to enter the mouth of the patient is the mouth of the patient. Some open a little bit more, some a little bit less,
Mhm.
but there are some basic things that I think will never change. So some conditions will never change, and we try to,
That's for sure.
or we have to try to adapt and get better
Mhm.
tools to improve our work. So this is basically what I see. I found an interesting testimonial or statement of you talking about the trend. A lot of people that have the money might come to your office and say, Nazariy, I want 20 white, pearl white veneers because I'm getting married next week. Can you do that for me? So how do you approach this let's say Hollywood smile thing of a lot of especially rich people who can afford like buying a Hermes bag? They come to Nazariy and say, I want I want 20 veneers. I don't care what the price is. How do you deal with these patients? And I'm sure you have these patients.
The first thing I would like to say that I'm happy to understand nowadays that people who come to my office, they trust me, first of all. We all spoke in the past how you are supposed to sell the treatment plan to the patient, to explain them, to impress them, to produce some emotions from the patient. Um, After doing these things also during the last 15 years, I can say that I built the brand that people trust. So if they come and I say you need to do, they don't ask me why. They just say, okay, if you say so, we agree. And if I say you don't need to do, they also say, okay, we understand. This is something that sometimes happens because everybody wants to have a super nice, bright smile nowadays. I'm not speaking right now about the fake stuff that is not looking good. We have to have this line in between. Okay. You can have BL3 teeth, but that look natural. My sister, she has natural teeth that are BL3. Her own
Wow.
teeth store, mostly two colors. So this is why if I see people, especially very young people that have amazing teeth, but because of the trend and because their old friends made veneers, they want veneers as well. I'm saying, I promise you're going to be my patient, but later. So for now, just go ahead, use your teeth. They look beautiful. I show the pictures. I convince people and they trust me. And then again, come back in 15, 20 years, and then we can discuss and maybe change the shape or improve your smile.
Well,
And one more thing I want to ask. It's sometimes very difficult to refuse because when people think about business and you have somebody who comes to your office and is ready to pay money, but sometimes refusing impresses the patient so much that they can speak about you with their friends and saying, imagine there is this doctor that I was ready to pay this amount of money, and he told me that you don't need veneers. So I believe that this doctor is really honest with the patient. And I believe that this type of promotion and advertisement for dentists is even better advertisement than doing a good case.
Totally
Because,
agree. But
yeah,
you were talking about the key factors. You have to connect with your patients. You have to create the credibility, the state that people trust you. So these are, and basically these are the key factors of being a doctor or being a dentist. For me, dentists are also doctors. It's interesting that in the English language, we have dentists and doctors. And you see then the discussions, is a dentist a doctor or not? But for example, in German, it's Zahnarzt, tooth doctor, and it's Zahnmedizin, it's tooth medicine. And I think this reflects more what we are doing. And also the trend that we have the connection of the oral health and the overall health. And for that, dentists are becoming more and more important to be like a consultant for patients, also to act as a monitor, as checking the patient's mouth and say, hey, come on, I see that you might have other health issues. Go and see the doctor, or I can recommend you a doctor to check your overall health more. And this leads me to a question. What is your relation to prevention? I remember when I was a student that we had the luck to talk to professors like Marthal or Müllemann, who in the 1960s, started with prevention. So telling people how to brush their teeth, that fluoride might be something that helps to prevent caries, building up dental clinics for children. And we had really, caries went down dramatically. And I remember that they were telling us, what we started in the 1960s, the goal is to eliminate our profession, or at least to reduce the number of dentists needed to treat the patients with accidents, do a little bit ortho, let's say, and the rare cases where there is periodontitis. But if we really work hard on prevention, we might come to a point where dentistry is only a small business and not a large business anymore. But people are lazy. They don't want to brush their teeth. They want to change their habits. But compared to medicine, I have read that in medicine, only 2% of the money is invested in prevention, 2 or 3%. In dentistry, I think it's much more if we take a look at what people invest in the dental hygienist and so on. So what is your message regarding prevention in your concept of dentistry?
This is what I think. I think that quite often around the world is business driven. Okay. And that's not a secret. You know it. Everyone knows it. Everybody who's watching this know it. And it would be really nice to do what? To raise fees for prevention. Because in those cases, prevention would become as interesting for dentists as treatment. And because prevention is usually quite cheap, dentists are interested just to treat people because they have to feed their families. in the end of the story. And this is why I think that would be a great move, because if you have prevention or professional hygiene that also brings income for clinic and at the same time keeps teeth of the patient healthy, I mean, everybody would win because dentist would benefit, his business would benefit, and patient would benefit because he wouldn't need implants, crowns, or the other treatments. And the natural teeth are the best, that's for sure, right? So I think we're slowly moving to that way. And the secrets and the key, again, is to educate people. Communication and education, for me nowadays, especially communication, is more, I think it's more difficult thing than dentistry itself. And this is something that I'm trying to tell people during the courses, that is, some animals are riding bicycles, like bears, for example. So it's also possible sooner or later to learn how to do the clinical procedures in dentistry. Okay. But what's often difficult, I've seen a lot of good clinicians, but they are not really capable of communicating with the patient. They say one wrong phrase, and besides they're amazing dentists, then something goes wrong and they have a big argument with the patient. So this is, for me nowadays, super important, the communication, because quite often people don't speak about this in lectures, in courses. Sit down, I'll show you how to make a filling. Sit down, I'll show you how to put an implant. Sit down, I'll show you how to prep for a veneer. Yes, but I have a question. What if my patient doesn't like the filling? How do I act? Where is the book that I can read about this? Can you recommend me? Not you, but overall. Or maybe there is a course, or maybe if I go to university, they teach me how to communicate with the patient if they don't like it, because we can never get inside of the head of our patient. This is why we have to be just like psychologists when we have the first meeting with the person, to get each other more. And it's not always that you start a treatment with a new patient. Sometimes it's better to say goodbye, because it's not only the patient who is choosing a doctor, it's also a doctor who is choosing the patient. And coming back also to the question about the prevention in my office, we have a rule that, for example, each patient who is getting dental service in our office comes to the professional hygiene and checkup every 3 months. So once we teach our patients to come every 3 months, usually their families also start seeing our hygienist every 3 months. And this is how we're trying to make the prevention more and more popular. And what we see, that when people are getting used to come every 3 months, even they call us. They say, hey, I'm in the city. Can I come right now? So I don't have to wait when your administrator calls us. So for people, it becomes a standard and normality. So finalizing my answer, I would like to say that it's in our dentist hands to create the standards. And if we want to change something, we can do this.
Absolutely. But you see, for example, in Switzerland, with all this history, there's no dentist without a dental hygienist. So, and I know that, for example, in France, dental hygienists, I don't know if it already has changed, but a few years ago, dental hygienists were not allowed to work with patients. So this is so silly. This is so silly that one of the most important parts of prevention, doing the recall, taking care of patients, talking also to the patients, because communication often happens also not with the dentists. A lot of patients, they go to the receptionists and asking questions they should have asked the dentist. And then the receptionist coming, Nazariy was with you and he had a question. And then you say, why did he ask the question to me? Why does he ask the question to my dental assistant? But anyway, it doesn't matter at the end. It's about having the good communication and coming back to paying things. And one example I very often cite is, transillumination. Looking for cracks, cavities, many things with fiber optics. And since when this is available?
Okay.
Since 1922, so 102 years. So 102 years. You learn, everybody sees it during the dental school, or most see it. And you know why almost nobody's using it. You can charge nothing for it. And that's the point that you were saying. If we could charge more for prevention, more would do it. If we could charge €5 to do the transfer illumination and explaining the patient, maybe in this situation, we don't even need to take an X-ray because I can see that there is nothing on your tooth. We can do the X-ray 1 year later. So these are the things. And I remember 15 years ago, I trained 50% of the dermatologists in Switzerland on photography. And I was like a little bit shaky. Oh, dermatologists, these are the guys that need to take pictures. And at that time, they told me, well, we do not take routine images because we cannot charge for them. Now they're doing it. Now they get money to take pictures of the skin. But 15 years ago, they did not do it. Something so easy to check the progression of a lesion just by taking pictures. And they did not take the pictures because the patient or no insurance was paying for it. So this is, I think we need sometimes to change also our mindset and offer some services to our patients, even if we know that we cannot charge it. But this maybe helps also to get more confidence or a better relation with your patients. What are your thoughts on that?
Alessandro, where is that line when we think that we should charge for every separate service? I will joke right now. Imagine patient comes to the clinic. I have a conditioner on. Probably we should charge him for using the conditioning in our office, right? Or maybe I have a heat on. Maybe we should charge for the heat that is not cold. Patient is feeling warm. Why don't we charge it? Those are expenses as well. Why do we include this? Or it's the same when I hear sometimes that dentists say, okay, we charge separately for using microscope. What if I look with two eyes? Should I charge more rather than when I look with one eye? So what I'm trying to say with this little joke, I'm trying to say that it's better all of these services to include in the price of your treatment. Because then, as you said, you will not be interested to use that or other technology. It's like I have some digital tools nowadays, and people say, okay, but do you charge for using this digital tool? For example, scanner. Let's say scanner, because some clinics are charging money for scanning. Okay. So I prefer to raise the fee of my treatment, of my service that I provide, and include in that fee that list of services, scanning, 4D jaw motion records, and the other stuff. So in my opinion, you don't have to try to sell each new device separately to your patient. I had one example from my life. Back in 2011, I believe, I was doing the treatments for a monk lady. And those days, I was doing a lot of cases completely for free. I didn't charge any money. Do you know why? Because I needed to get together some information, some clinical work, so I could convince my future patients that I can do something good for them. And you know what? I was taking pictures and also videos of that lady, and I didn't charge as well. I was not even charging for the crowns that I made for her. And then I recorded a video. And if you go now to YouTube and you type preparation for full crowns with a microscope, you will find my video that has about 2 million views. 2 million views. And from that video, I received new patients. From that video, I received a lot of participants of lectures and also the courses. So I'm always asking the participant colleagues, I'm saying, what do you think? Did this case pay back to me? 100 times. No, probably 1,000 times. So this is the advice and little conclusion. Don't think about making profit this second. Do some work right now so it will pay back later. Maybe in 1 year, maybe in 5 years, but it will. So don't try to be, I would say, maybe greedy is not a nice word, but don't try to make money right now at this second. Build the strategy, build the long-term strategy. So in that case, as I said previously, when you look back at yourself 10 years ago, you will see that now you are in a different position with a different technology, with a different patients, with a different profit, and the freedom to do proper dentistry. We often like to speak only about the teeth. Some dentists maybe don't like to touch the financial side, but you gotta touch the financial side because otherwise you will not have the freedom to use the new technology, to use the new materials, and all the stuff that you dream about as a dentist. So it's a mix. It's a mix of being a great clinician, but also being the person who can position himself properly on the dental market.
That's a great final word, because this touches something that the young generation needs to learn. A lot of young dentists, they think I start immediately making a lot of money, but they miss one point, and you nailed it. You nailed it. That you first need to take some efforts, show something, do something before you start your career. It's not coming like this, because too many young dentists might see what you're doing on social media, on your workshops, on your videos, and they just want to become like you tomorrow, in one day or in one week. And this is a perfect final statement, motivating not only the young generation, but the dental community to think a little bit, what can I change? If you may be a more seasoned dentist, you might say, okay, even after 10, 20 years of practice, maybe I can change something that changes my life, my career, getting more fun back in my work. This is something I discussed yesterday with Kylie Stanley about the mental things, the mental situation, because dentists, for me, and I don't know how you feel it, dentists are a little bit resistant against change. So they prefer to run in the hamster wheel and, well, business is doing well. I have my Porsche, I have this, and what else do I need? And maybe then they run into other issues. But I think the start into a dental career, that's exactly what you mentioned. Show first that you want to do something, that you want to push, go in extras, and don't ask for money at the first day. So this, I think, is an important message for the young generation, but also for the older generation, to be a little bit more generous, because I think being positive, giving things, gives you always back. That's what I also feel in
100%.
in my life. And and sometimes, if, let's say, not charge for something, I have this also sometimes poor patients, and you do the extraction and forget about the 100 euros or whatever, and do something, and you feel good doing this. So these are the things, and it always pays off later, as your perfect thing with the video that you did on the preparation. So I really like what you're doing. For me, you're an inspiration since many years. As now you're already becoming a seasoned dentist. So, but you're still in the younger generation, and I really appreciate what you're doing, and continue your great work. And I'm sure that we will do another interview in 1 or 2 years, and you will tell us, maybe, I don't know, you will have the first dental clinic on the moon, or I don't know what's going to happen in the future. But I wish you all the best with your family, because again, this is the most important social thing. The anchor for all our careers is a intact family. And you see that examples of our colleagues that lost their families, and they lose not only the family, they lose everything at the end. But keep up your great work, keep up your inspiration, and I hope to meet you in person. I missed your lecture in Salzburg for the Neue Gruppe. I had another meeting that day, but I'm sure that our paths will cross one day somewhere on the planet, for sure. So thank you, Nazariy, for you taking your time for inspiring the dental community, and keep up your great work.
Thank you. Thank you, Alessandro. Thank you again for inviting for this nice conversation. And I would just like to give maybe a very short takeaway message for especially young generation. Back in 2010, I was inspired by people that I respect a lot. I believe that there is a part of people who are dentists who are also following me, my work, and I want to tell them something. Maybe they don't have scanners, maybe they don't have microscopes, maybe they don't have the newest materials, but what they have is time. And I believe that time nowadays is the most precious currency. So, guys, just go ahead and use it, because your success is only in your hands. There is nothing impossible. Thank you.
Thank you very much.